Yes, welcome, SLP215. So this week, module 3. So last week we talked about dysphagia. This week we're talking about voice. So of all the areas, I think voice is my least competent area because I really haven't treated a whole lot of voice. So I think Chris Schwan, who does SLP 210, I know she's treated voice. She's probably our most seasoned voice therapist for what she's done. A couple of things. So again, there are SLPs that work on this. Can you as an SLPA work on voice? Absolutely. So it's kind of like a niche. I would call it a niche area. A lot of times these SLPs work out of ear, nose, and throat specialist office, work with maybe audiologists. A lot of times you see great voice therapists at a university because they have all the equipment required. So the problem with voice is a lot of times you need a lot of instrumentation to help support in the best way. So let's look at, okay, hopefully, one second. There we go. Sorry, trying to let people in. When you're screen sharing, I don't know why it's so difficult. So a couple different things. When you look at this, and I tried out all the links. I hope that they work. If you're having problems, last week, the same links we've had forever, and then I just had to repost the link. It just wasn't divided up. I just had to put them in one link. So if you have any problems, let me know right away. And sometimes here's the problem. They work for me, but they don't in the student view. Like if I change the student view, sometimes they don't. I'm not real sure why, but okay. Voice disorders. So when we're looking at diagnosis, a lot of times, let me go to what are voice disorders. So what I like about this is kind of a very, what I call narrative of a voice disorder. So we're looking at, there are various factors that cause voice disorders. Now, this can be a physical ailment, a structural issue, things, growths in your larynx, on your vocal folds, other irritation, I'm sure some of you have had a cold or some kind of respiratory issue and then have had a hoarse voice, or just something simple like swelling, or if you've been around, I know sometimes I react to chemicals. So if you're having like work done in your house, I know sometimes that affects me. I know we were doing the floors. I had some strong reactions to the chemicals. They definitely affect like my voice. So there are a variety of reasons that can cause a voice disorder. And then when we're looking at sometimes neurological disorders, a lot of times we see those characteristics affect their voice too. So other things too, endocrinological, I'm not sure I said that right, like hormonal disorders can definitely impact, as well as other things like thyroidectomies, which is a pretty common surgery, or other heart bypass. Sometimes the way they do it can affect your voice. So definitely even just some surgical repercussions can affect your voice. So a lot of the time before we treat, let me back it up. Almost 95% of the time, we have an ear, nose, and throat specialist determine if somebody has a voice disorder and if it can be treated. Now, again, a lot of times we can review some vocal hygiene, or if we suspect some vocal abuse behavior. So the only time it gets a little challenging is we're just kind of working on the prevention. You think maybe somebody, for instance, we work with a client that does some poor vocal behaviors, or they do what I call abusive vocal behavior. So my mom does this and it drives me crazy. So we're on the phone, she does this. the whole time on the phone. And I explained to her how much time she does this. And I do think it affects her voice. By the end of the phone conversation, it's like she can't. It's really hard. Like she's really putting a strain on her voice. I was telling her, that's some abusive behaviors. Quit doing that. And just other factors. I don't know if you've ever been talking and it's so dry. I think it occurs here in Arizona that you just kind of it's hard for you to talk. You need some water. So a lot of things too, we might work on just preventing a voice disorder. We might review some good vocal hygiene. So sometimes, let's say we have a client on the spectrum that does some screaming or high-pitched squealing. I had a girl, she had a beautiful voice. I mean, she was an opera singer, really. She had autism spectrum disorder, but she did a lot of vocal abusive behaviors. And we did talk a lot about, hey, you can't do that. That can ruin your voice. Here are other strategies to try. So I supported her not having a voice issue. I didn't really treat a voice disorder. She just did some vocal abusive behaviors. But let's say somebody has polyps or somebody has vocal nodules. Those are all diagnosed by ear, nose, and throat specialists who then recommends therapy. So typically speaking, to treat a voice disorder, we get a evaluation from an ear, nose, and throat specialist, and then they recommend the treatment. They kind of recommend the treatment plan, and then we go through those things. So the only voice I would say we treat without an ear, nose, and throat specialist is really working on just good vocal hygiene practice. So that's good for all of our clients. Drinking water, keeping your vocal folds hydrated. A lot of times too, reminding some of our abusive behaviors like too much caffeine definitely can dry up your throat. And I need to also take my own advice on that. I've been caffeine central these last 2 weeks. And I can hear it, actually. I definitely notice it. The other thing too is what should we do to not strain our voice? Again, a lot of times when you look at something like someone who does choir or cheerleading, they should definitely warm up their voice. You're not, putting a lot of vocal strain. Throat clearing is not a gentle movement on the vocal folds. So we might try some other behaviors if that's something maybe they do. A lot of times we work with kids who have, say, vocal tics and talking about how to maybe reduce that or work on some other replacement behaviors. So like my person with autism that I worked with, and I worked on kind of some of just that vocal hygiene stuff. We definitely try to work on some different replacement behaviors. And it was more what I would call stimming. I think she stemmed off of it a little bit. And so, we tried some different strategies for that. And really looking at, do I need amplification? So I don't know why, but I've never been on Zoom all day until very recently in this past year. And I don't know why, but I yell at Zoom. Definitely have some vocal strain at the end. And, I call her my co-therapist and we were laughing because we couldn't be in the same room and do Zoom because we're both way too loud. So I don't know why, but we were talking about how that's really not good for our voices. Because after like 3 days of that, my voice was not good. So just being recognizing what's maybe an abusive pattern, what are some things we can do to reduce the strain, and what are some things that if we hear in our voice that maybe we need to direct a client to an ear, nose, and throat specialist. But for instance, a lot of times they have to, examine the vocal folds, maybe run some tests. That's obviously things that we don't do as SLPs, but looking at symptoms. So symptoms we look out for. So for instance, if we see a client regularly and we notice a lot of hoarseness or shortness of breath, harsh or rough voice, breathy voice, or a decrease in pitch and range. So I don't know. I definitely noticed a difference when I was pregnant with my twins. I swear I couldn't talk. Definitely noticed some changes there. Obviously hormonal, and then we've got some structural things that definitely impacted me that I definitely struggled with. Or if someone has chronic reflux, can definitely affect your voice. So, what are some symptoms that maybe I need to go get checked out? So, again, you notice this, you're working with a client, maybe you're doing other things, you're addressing language or artic, and then there's some voice challenges. That's definitely something you want to bring to your supervisor's attention, because that might be a referral that they need to make to, recommend that you're them the client to see the ear, nose, and throat specialist to determine what the issue is. So, and we see it a lot with adults. So aphasia, dysarthria, we see like, breathy or shortness of breath, really decreased range in pitch. So a lot of times we need an ear, nose, and throat specialist to determine what we can and can't do and what can be helped or maybe not helped. And then be familiar again with how voice is produced. So that's kind of a good little refresher. I know you guys talked about it in SLP210, but definitely review that if you feel like that's, something you don't remember well. So voice is produced. So we'll talk about, the Bernoulli effect. Basically, the vocal folds sit above the trachea. So remember, we'll do a little bit of a quick SLP210 review. The vocal folds sit right above your airway. So if your airway is compromised, you definitely will have issues with voice. So, and then they're contained in the larynx, and that's kind of the middle of the neck behind the Adam's apple. So that's where your vocal folds, vocal cords, trying to think, we always have like 3 or 4 names for the same structures, so I apologize. And they close up. So when you're taking that breath, it's that change of air pressure that causes the vibration that then produces the sound. And then, the mouth is kind of the filter of that sound. So when we've seen somebody who's had neurological damage, or let's say some paralysis, so facial paralysis, that's why your voice can be different, because that filter is not the same. So just kind of be familiar, make sure you understand how, so like obviously the appearance of healthy vocal folds, when they use instrumentation, look at it, what are they looking? What should they look like? So if you look on this diagram, hold on, let me enlarge this. And I've had one student, and I've had him for a long time. I think he's a junior now. He has repeatedly come to me for short periods of time where his ear, nose, and throat specialist has recommended voice therapy, and we have done it in school. And I do it exactly the way the ENT prescribes. And he's had a long history of some structural issues with his voice, as well as vocal cord, I don't want to say damage, but frequent nodules that have had to be removed from vocal abuse. So he's had some challenges. So I have definitely, and every time it changes a little bit, I let his mom know, and she takes him back in and we see what we can do. But for instance, a polyp, the reason why that can change is the vocal cords then don't hit accordingly. So anytime somebody has real breathy, you want that checked out, make sure there's not, some kind of growth. And just because you have a polyp doesn't mean it's cancerous, but definitely some things you notice you should get checked out. Obviously, I think all of us have had temporary hoarseness or other things. The other thing I want to tell you, I've noticed just in how much vaping, I don't think we have good statistics or data on how much vaping can affect voice. But just my own little microcosm where I work at the high school, I definitely think I can start to pick up when a student has been vaping more, maybe more. I don't want to say never, but more. I do think that has some negative effect on their voice and their vocal cords. I don't think that's just my own little informal little thing, but definitely some things that maybe we don't even know the scope yet. But allergies definitely can impact our voice. Some of those habits, clearing your throat, smoking, obviously, and I'm going to add vaping in there. And then the overuse of voice. So Who's the biggest person at risk for a voice disorder at the high school? Cheerleaders. Definitely reviewing some good vocal hygiene is probably always a good idea if a person you work with is a cheerleader. And then, what do? What do they say? What is your doctor? Drink plenty of clear liquids, definitely hydrate. Persistent hoarseness for no explanation should absolutely always be checked out. And always remember that if we are treating a person for a voice disorder, they have had a evaluation from an ear, nose, and throat specialist. So this is where it's a little bit different. An SLP might trial some therapy activities or treatment kind of protocols to see if it helps, but always the ear, nose, and throat specialist is the one that diagnoses a voice disorder, and then we do the treatment. So they kind of write that script for treatment. And that actually holds true in school too. Like I said, I have done vocal hygiene things with a lot of different people in clinic-based and school-based. Definitely in the rehab hospital, we reviewed some good vocal hygiene. So someone who's recovering, they've been intubated, they might actually have some permanent damage to their voice. So I have done that in the rehab hospital too. But again, and that's more of how do we take care and preserve the voice we have? Because a lot of times you can't get back what's damaged or fix what's damaged when it comes to voice. So we're trying to preserve and keep things optimal. And definitely some main treatment targets is eliminating vocal abuses, maybe coming up with some other replacement behaviors, especially if it's, habitual, stemming, that kind of thing. And then also sometimes we do some things with pitch. That is not my area of expertise. I did have a person I worked with at the rehab hospital that was a lot better, especially after someone's had some paralysis, finding that tone is a lot easier, and kind of that stress and relaxation exercises to kind of reduce tension. So sometimes people might carry a lot of tension in their voice, especially if they've had damage to the area. So that makes it worse, not better. They're kind of guarded. They, especially after coming up intubated or they've had a tracheotomy. So somebody's had a tracheotomy and it's healing, they're closing it up. Definitely their voice can have lots of changes, or what I call limited movement. So they didn't have as much span of movement or as they did before. So that definitely kind of changes that fundamental pitch. And then a lot of times there is surgery. Sometimes there's not surgery. Obviously laryngeal cancer, that's a big, I know I graduated with a girl that works at the veterans, the VA. She's worked with a lot of like head and neck cancer survivors. So she's actually, the wealth of knowledge she has on how to improve vocal function is great. That's another big group. So those people who've had cancer of the head and neck, really like the throat, pharynx, that kind of thing. Definitely many therapists there are treating voice issues to help them become, optimal communicators. So puberphonia is another one that's kind of that weird one. I know we have a clip on here, and that's more of a psychological thing. It could be psychogenic, kind of talking in that higher register, kind of maybe avoiding that puberty thing. So spasmodic dysphonia, that's kind of an odd neurological disorder. Sometimes it, like I said, most often occurs in individuals between 30 and 50 years old, and it really affects women a lot more than it does men. So spasmodic dysphonia is another one that has to be diagnosed by ear, nose, and throat specialists. There are some things that we can do to support that. You've had now paralysis. So a lot of these people with an acquired communication issue, a lot of times they didn't have paralyzed vocal folds and now they do. So definitely some things that can impact your voice and communication. And so treatment. and this is the key piece I want to kind of touch on. Most of it is behavioral treatment includes voice therapy by a speech language pathologist and may be the only treatment required for the individual. A lot of times they are getting other treatment. So we're kind of maybe one piece of that. A lot of times we're not the sole person helping maybe with paralysis, because a lot of times they're having paralysis in other areas. So it's the cause of the paralysis. Can there be improvement? Sometimes paralysis is temporary, especially after a major accident, especially after some trauma your body suffered or some surgery you just had. So hopefully what we see is improvement. And then other things that we do is kind of work on what are some other compensatory strategies. A lot of times too, they do a lot more like head turning, things like that, depending on what side's weak to help improve the quality. And that's a lot of trial and error. And really, when we're looking at speech therapy, treatment for voice disorder by the speech pathologist, we're usually the best with those mild cases. I mean, those are the ones I think we can impact the most. And really just kind of reviewing relaxation, breath control, maintaining a steady flow, working on that fundamental pitch to see if that helps. And as well as what are other compensatory strategies should I do if I have to use my voice a lot? So the other big group that is real at high risk for acquired voice disorders is teaching. Wonder why? We're always talking over kids. Or adults if you're at the college, although Zoom wise, since we've been Zoom now, I guess since going on a year, we're not necessarily talking over adults. But what would you be responsible for? So looking at what would you be responsible for? Like I said, in a pediatric setting, it's usually very, very specific. A lot of work with vocal hygiene, kind of helping reduce that vocal hyperfunction. It might be more behavioral strategies. If you don't know or what you should be doing with regard to voice, definitely talk to your supervisor. Or you're working with a client, you're working on a related speech and language issue, and then you're noticing voice changes. So that should definitely be something that you discuss with your supervisor, especially for somebody like a perfect example is we have a client with muscular dystrophy, and we saw a lot of changes real quick in his voice. So we got alarmed and we thought, oh, we need to make some adjustments. ALS, Parkinson's, there's LSVT, that's a voice treatment that they use for people with Parkinson's.
Can multiple sclerosis give it?
Say that one more time.
Can MS give it multiple sclerosis?
Oh yeah, for sure. And again, it depends on the severity and the extent of progression. So any of those progressive neurological disorders, we definitely see issues in voice. Like I said, muscular dystrophy is one I see in the pediatric setting quite a bit. I had one girl, and she was one of my favorite clients I've ever worked with, and she was just a wonderful soul for sure. She was one I had in as a first grader, and I definitely started noticing voice changes with her at the end of her sophomore year. And then I noticed other things too, but the first thing was voice. I remember talking to her mom. She's like, I noticed that too. I thought that was weird. And, she didn't have, she was your average, what I would call, student with a learning disability that, I worked on a few little pragmatic things with her, but we didn't recognize at the time some of the key pieces we saw were neurological. She ended up having ALS, and she had probably the most aggressive form of ALS I've ever seen. And but what was interesting is I remember calling the mom, and she's like, I feel like it's changed a lot in the last 2 weeks. I said, she had a cold, we went through all these things. And then when she took her I said, you really need to go to a doctor because I'm getting concerned. And yeah, that's when the ENT then referred her to the neurologist. And then we found out we got that ALS diagnosis, and it started from the voice. That's how we found it. So again, you have concerns, something changes with any of your clients and you notice some major changes with the voice, definitely, and there's no what I would call reasonable explanation. Sometimes it's allergies, sometimes it's the air, sometimes it's whatever. But if you notice, definitely alert your supervisor, because sometimes that shows some neurological things that it's kind of your telltale sign. But yes, MS is another one. Like I said, the big one in the pediatric population is muscular dystrophy. And then with our adults is usually Parkinson's, as well as ALS. And then there's one more. I can't think of the other one off the top of my head. Sorry, I'm drawing a blank. But so voice, it's kind of a specialty niche. It's kind of one that might co-occur with other speech and language issues also, as well as when we're looking at our, what I would call our medically fragile group. Definitely we see some voice issues, or anybody who's had a trach for extensive amount of time. And a lot of times there's someone who's recovered, and for you as an SLPA, you're doing the rehab part. So, you know, they're kind of relearning how to use their voice. So you definitely could see that in private placement, or excuse me, private practice, clinic-based, home health. A lot of times you're doing home rehab, especially for people who've had, you know, trachea, you're trying to get them back to functioning. So definitely home health is another big population. You might see some voice stuff. So any other questions? So this week, let me just review the assignments. Oh gosh. 1 second. Let me go to our assignments this week. So there is a quiz, there's a voice observation. So I don't feel like we have good options that much in Master Clinician, but so do the voice observation, then the assessment. But I would definitely, as I was just telling my other class, I don't know, I feel like a lot of you are in both, maybe not all of you, but most of you, definitely do the read and review summary. I do think it really helps you to do the assessment. So I highly always recommend do that first and look at all the information and then go and do the quiz, because I think that way that information is fresh in your mind, and it's kind of a good way to help you study for the assessment. Okay, any other questions, concerns? Hold on, I can't ever see the chat box. And speaking of allergies, the minute I start saying that word, my nose starts itching. There's one in the chat. Okay, so yeah, always, 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 if you learn, this is part of our course competency. We never do direct voice therapy without an evaluation from an ear, nose, and throat specialist. So when I say ENT, I'm always speaking about ear, nose, and throat specialists. Those are the doctors that diagnose voice disorders or possible causes of the voice disorder. Sometimes the, you know, the origin of it might not be a ear, nose, and throat related issue, but usually they're kind of that first step, and then they usually refer out. Every now and then they refer to the gastro person if they've got massive amounts of reflux. Yeah, you get that reflux, take care of that. You know, take your meds. That's not good for your esophagus or for your trachea for that matter, because they're like right next to each other. So that reflux coming up definitely can impact your vocal cords. You know, that's definitely a factor. So, you know, take care of that. So a lot of times that ear, nose, and throat specialist is referring to other specialists. If some of maybe the origin of the voice disorder is not, you know, it's kind of a different area. A lot of times it is. So, and then it's usually a group. It's kind of maybe the doctor, 1 or 2 doctors involved, as well as the therapist working on addressing that issue. So any other questions? No. All righty. Good job on last week. I think you guys did a great job in module 2. So try to have all those, like I said, I'm trying to get everything graded by Wednesday. is my goal. So if you have any other specific question, just always please feel free to message me. Okay?
Thank you.